to Ranjan Dhar and get his sense of the capacity that's being that's been mobilized in this wartime effort to ensure that adequate oxygen is produced and then supplied. Can you give us a sense of what you're doing at ArcelorMittal Nippon Steel and how this is going in your view?
Now, to put this number in perspective, India in the last count, total need for LMO countrywide was nearly about 7,000 tons. So suffice to say that the steel industry alone can, suffice this need. Now, the issue, as you rightly pointed out, is how do you bring this oxygen from the steel mills or other industries to where it is used, for example, the hospitals.
Look, I was in fact searching that letter, which I always had on my table, but today I don't know, I have misplaced it. The letter was of last year. It was in 2020 that a letter was issued around September, October to almost all the states that you have to ramp up your oxygen production in keeping with a second pandemic wave that might happen in this country, and this was by the Drug Controller of India. Almost all the states received this, and in fact it also categorically spoke about how the industrial oxygen can be converted into medical liquid oxygen, LMO.
Where people have been managing with oxygen cylinders, for them to just now move towards any other form and then have storage capacity, as very rightly pointed out, it's a highly inflammable part, and thereby they don't have that ability to be able to do it just now. So we have to support it. Yes, the oxygen concentrators are going to come in, but we have to be extremely judicious about it. Today, the severely impacted and critical patients require this.
The Honorable Supreme Court today said, and I quote, and they said this to the central government, they remarked and said that as a national authority which has a responsibility to the national capital, you are answerable. The central government today was pulled up by the Honorable Supreme Court on the following grounds. Number one, what has been allocated to us as oxygen is a mere paper allocation. We demanded roughly 700 metric tons of oxygen. We were allocated initially 378, then it was revised to 490 metric tons. But even the paper allocation of 490 metric ton is not actually being received in Delhi. What is being received is close to 350, 360, on a good day 380 metric tons. So there is a big shortfall between what is being delivered and what is being allocated.
Viewer point of view, the fact that you are now confirming that this variant is airborne, that means I could be sitting at home and also get infected? Is that, earlier it was suggested that only when I went out in crowded places would I possibly, I would possibly get the virus. Now, sitting at home, I could get infected.
Thank you. Yeah, thank you. It's a very nice question actually, because in home situation also it's a dynamic situation. If people come and go, from in the home setting, they might be asymptomatic distinct carriers of infection. So that's why we are always, when we go out, we are advocating the double mask for prevention of the mutant strain and also any strain. I'd say that basically that is important. The second part is that when we are in home setting, we still are not very sure that somebody may have brought the asymptomatic infection as well, because quite a number of infections, whether it's a mutant strain also, can be asymptomatic, but then they can spread very, very fast. So that's why it is important to follow COVID appropriate behavior even in home settings. That means you wear mask, you maintain a distance of, we say 2 gaz ki duri. So that is important part of that. But we always have to be cautious that home setting also nowadays is not very safe, and we have to follow the precautions at home as well.
Why don't you take this, Dr. Swaminathan, because you are Director Infectious Diseases as an immunologist. Tell us, why are people in the age group 30 to 45 being affected this time in such large numbers? What explains it?
Actually, a colleague of mine just sent me the IDSP data from 30th of April 2021 as of 8:15 p.m. And I'm looking at the percentages of patient population in India affected by COVID. 21.4% are between 21 and 30 years of age, and 21.47 between 31 and 40. So the highest distribution of age group for which COVID is being reported is the 20 to 40 age group. If you look at admissions also, we are seeing a disproportionate number of admissions in the age group between 30 and 60. 45 to 60 especially being disproportionately high. Couple of reasons. Number one, the 60 plus age group, the percentage of vaccination penetration is probably much better. In the 45 to 60, the penetration of vaccination has been much poorer. The second is that this is the group of people who are more active and out in the community trying to earn a livelihood and therefore more exposed to COVID as such. And the third possibility is also that you had a much greater banging of the older community in the first round.
How do you see the vaccination for all drive rollout starting the 1st of May, and when is Chhattisgarh likely to begin the drive?
We are starting tomorrow, Gaurav, and it's an uphill task. Uphill in the sense that we have limited vaccines in the country, but whatever vaccines will be available, even in this lockdown, we will try and see that as many people as vaccines are available get covered and vaccinated.
Excellent. Sir, there was an apprehension that there could be a lot of crowding, and Delhi Chief Minister Arvind Kejriwal has asked people between the age group of 18 and 45 not to queue up at vaccination centers till the time things are better. Sir, you've placed an order for about 25 lakh vaccines with the Serum Institute and another 25 lakh with Bharat Biotech. How soon are they likely to arrive, and what is your total requirement?
We will be placing another 25 lakh vaccine order with Serum Institute. Bharat Biotech has been more forthcoming, and they are making 1,50,000 vaccines available tomorrow morning. So those are the vaccines with which we are going to start. We will be rolling them out tomorrow. Those places where logistically the vaccines will not reach tomorrow, they will be covered started from day after.